Oral malignant melanoma is a rare malignant tumor that develops from the melanocytes in the oral cavity. It's aggressive and progresses rapidly. The cause is unknown, although it's associated with pre-existing melanosis, dental irritation, cigarette usage, alcohol consumption, and formaldehyde exposure. It accounts for 0.2 to 8% of all reported melanomas, and early detection is critical for effective treatment. It has a higher tendency to metastasize and attack tissue than any other malignant tumor in the oral cavity. The palate and maxillary gingiva are the most prevalent sites of this tumor. Most people don't give themselves regular oral exams, so oral malignant melanoma usually goes unnoticed until it progresses. Signs like increased swelling, tooth decay, or bleeding will lead people to getting these lesions inspected. It often appears as blue, black, or brown mucosa, and is typically not painful in the early stages, which also leads to delayed diagnosis. No symptoms recorded in nearly a third of the population at the time of diagnosis. Once the lesion develops, signs often include pain, ulceration, bleeding, and swelling of the localized affected oral mucosa. As the tumor grows, pain and difficulty eating become more common symptoms. It may initially present as a macule, which is a flat or blemish-colored area, or a nodular lesion. In order to diagnose, a biopsy needs to be performed by obtaining a tissue sample to examine.
Malignant melanoma is a rare but aggressive cancer that most often affects adults, particularly males and individuals of non-Caucasian backgrounds. The risk increases significantly among tobacco users and those who consume alcohol, especially when both habits are combined. People with pre-existing pigmented lesions in the mouth should be especially cautious, as they can sometimes transform into malignant melanoma. Early detection through regular oral examination is vital, because once this cancer spreads, treatment becomes much more difficult. Smoking and tobacco use are the strongest risk factors for developing oral malignant melanoma. The mouth is constantly exposed to carcinogens. Over 86 of them have been identified in tobacco products alone. Chronic irritation from heat and chemical causes continuous stress to the oral tissues, which can lead to dangerous changes over time. Smokers may have developed pigment changes known as smoker's melanosis, showing that tobacco triggers melanocytes, the pigment-producing cells. And when alcohol use is added to the mix, the risk multiplies dramatically. Together, tobacco and alcohol create a powerful and preventable cause of oral cancer. The primary treatment for oral malignant melanoma is surgery, specifically radical excision with clear disease-free margins. This is always the first line of defense. Radiotherapy and chemotherapy have used in adjunctive therapies, though melanoma is generally resistant to radiation. Chemotherapy agents such as platinum analogs, nitrosouris, and dacarbazine have been tried, but response rates remain low, often reserved for advanced cases. Immunotherapy, including interleukin-2, has also shown limited success. While these treatments may help slow progression, early surgical intervention offers the best chance for control and survival. Tumor location, whether on the palate or the alveolar gingiva, has no major impact on survival in oral malignant melanoma. Although there is a slight male predominance, gender also does not influence survival outcomes. The most important prognosis factors are related to the tumor's appearance. Non-ulcerated and highly pigmented lesions are associated with better survival rates, while ulcerated and poorly pigmented tumors generally indicate a worse prognosis.
Even with treatment, survival rates remain low. About 58% at 2 years, 42% at 3 years, and only 29% at 5 years after diagnosis. In advanced stages, the cancer spreads to vital organs like the lungs, brain, liver, and bones. This leads to organ failure, severe pain, and respiratory distress, highlighting the importance of early palliative care for comfort and symptom management. Clinically, prognosis depends more on the tumor's characteristics than on the patient's demographics, making early recognition and biopsy essential steps in care. Prevention. Although the exact cause of oral malignant melanoma isn't fully understood, there are several ways to reduce risk. Quitting smoking, limiting alcohol and irritants, and maintaining good oral hygiene can help protect the tissues. Regular dental checkups and self-monitoring for unusual pigmented lesions or color changes are also crucial. And in conclusion, despite advances in therapy, the overall prognosis remains poor, with survival rates declining significantly within 5 years of diagnosis. Ultimately, early detection saves lives. Practicing consistent oral care at home and reporting any suspicious changes to your dental professional can make a significant difference in improving outcomes. Thank you for your attendance during this presentation.